Okay, and welcome. This is another of a series of 1 hour exercise sessions. We'll be working on bone density building, preventing sarcopenia, loss of muscle and loss of function, building up your muscle tone, balance, maintaining your cognitive abilities. You know, anybody is welcome. People from feeble elderly to advanced world-class athletes will benefit. We're going to each week cover one particular exercise in detail, and it'll be different topics like back pain, sprained ankles, vision, toe strengthening, wrist and elbow, tennis elbow, like all kind of topics we'll cover. Agility, quickness, keeping up your speed, cardio, like all kind of things. We're always going to start though with a bit of soft tissue work. There are many factors in our lives that are consistent amongst the population. We all try to stand up and walk. And we have to do our work sitting down, and we sit at computers and steering wheels. So the chest, the pecs get tight. So I always like to start by just rolling out the muscles here in the chest. Specifically, you can do just globally around if it's a bit sore. It always feels pretty good. Door frame is best, and head down. The head should be turned away from the ball to not crank the neck. Yeah, degenerated discs and necks over time. You know, so many people who are very inspired about exercise are people like 50s, 60s, 70s, because you start falling apart. And there are well-researched ways that you can prevent that, but you do have to do the work for it. Okay, the other side of the chest, and again, turn the head away. Depending on what you've been up to, some days it'll feel a little tighter, some days not as. Sometimes it's very sore for people. It really shouldn't be. Might be a little crunchy and thicker, but over time, if you keep practicing, the tissue quality will always improve. Okay, now feet, of course, everybody wants to have stronger and more capable feet. So we'll just roll out, take that ball and roll out the arches in your feet. There's an arch between the second and third toe in the forefoot, and then on the outside of your foot, there's an arch just like above the heel on the outside edge of your foot. And then, of course, all the plantar fascia around your heel, into the toes, the other foot. We're going to not spend really much time doing any stretching and things like that. We do corrective exercises for our alignment so that when we do the weightlifting, our bodies will be in better position. And our training sessions will be the first about half hour or so is preparatory alignment work, back strengthening work, foot strengthening work, just basic foundation. Second half will be the strengthening with weights and bands. Okay, so that was great. So now we're going to do a few things on the floor. And if you can't lie down on the floor, you can lie down in a bed. So what you'll need is a broomstick, this massage ball that we were just using, a strap for stretching the hamstrings. Tight hamstrings, that's another common topic. But today we're going to speak a little more extensively and demonstrate a really important exercise for the Ltwt muscles. Today, I would say that the focus of today is the most critical for everybody. Okay. And also we'll be rolling out the quadricep muscles, the thighs. For that, you need a full roller or a rolling pin. So now here on the floor, I'm my own cameraman, so I'm sorry if the video sometimes the angles aren't optimal, but we'll do the best we can here. Okay. So we'll start with the ball in the upper trapezius. So the upper traps, right here, we'll start on the left side, the base of the neck, and just slightly back to the side. if you bring that arm straight up, or just up wherever's comfortable, and then you'll probably it's a bit hard and thick. So you can either just hold, putting pressure onto it, like trigger point, releasing it, or you can kind of roll it side to side, whatever you like to. You can spend a lot of time with the massage ball and foam roller, and I do have videos about that. But for the purposes of our training, we want to get our strength training, we need our cardio, we need all of it. And so I'm trying to make that really efficient. Okay, now we'll switch to the right side. Arm up. And either just press on that hard part, or you can move side to side. And this will allow your arm, the rotator cuff, to move more freely. And the shoulder blades, many of us, the shoulder blades get stuck up at the base of the neck. They're too elevated because the upper traps are pulling up, and that pushes your head forward. It's a really important one for everybody. So next we're going to work on the gluteus medius attachments into the hip socket. And here, put the ball just lying on the back. On the left side, just lift the hip up a little and put the ball under the hip. Not too far under, just more at the edge. But then if you lift the hip up on top of it, the ball will sink into like a valley, which is the edge of your femur bone, the trochanter. We're going to just, again, either put pressure if you feel a band of the muscles, the tendons that are really tight and sore, you might just put pressure. Or you can move the ball around as you like. And again, day by day, if you've been in the garden for a long time, your hips might be a bit more sore. You've gone for a long hike, other leg. Or sitting, like a long time of sitting, your hips will get really sore. Okay, so now the right side, just on the outside, and lift the hips up slightly. So the ball can dig into the connective tissues. Particularly on the right side, often on the outside, the lateral component gets really stringy and hard. So you might lift up a little higher, go to the outside of that hip more. Sometimes, if your nerves are being pinched, your leg might go a bit numb or tingling when you do that, but it'll clear. This is helping to clear the lines. We'll put the ball just behind the head and working on decompressing the spine. And if you just relax with your chin down, your spine will calm down. So we're trying to release some of that stored tension that's pulling on our spinal column. And now we're going to just gently nod. So this position will help release the muscles in the back of the neck, the suboccipitals. And there are many muscle spindles in there, so it's important for proprioception, to be able to turn your head. Now relax and just take a breath. And nodding. And a breath. Without lifting the shoulders. Okay, and now keep the chin down angle, but only with your eyes. If you look up and down with your eyes, then the muscles in your eyes will be attaching to this, actually the neck and the spine. So that action will also help elongate the spine. And take a deep breath. And help with your proprioception and balance. And eyes up and down. And if you're younger, you don't think you need to bother with this kind of stuff, your neck feels fine. You have a long life ahead, best deal with it now. You'll be way better off than we are now. Everybody that I met has said, oh, we should have started doing this when we were kids, and I would totally agree. Okay, now we'll put the ball away. So now we're going to work on the hamstrings, but as well, we want to make sure the bone, your femur, rotates in the socket of the hip. So the strap goes on the right foot, and you take the strap in the left hand and wrap it around the back of the right calf. Hold on with the right hand. Keep the knee stable and the ankle stable as you rotate. So you're only rotate your femur in the socket of your hip is rotating in and out. And then you unwind it and just stretch hamstring. Always, you should never feel this behind the knee. Okay? If your hamstrings are really tight, sometimes you'll end up straining behind the knee joint. So better is if you feel it behind the knee, just bend the knee a bit and stretch here, not overstretch back of knee. Okay, left leg. Why? If you overstretch the back of your knee, it's going to be a weak knee. Okay, left foot, right hand with the strap, wrap it around the back of the leg. So keep the knee and ankle stable, foot flexed, and then rotate the femur, clearing your hip joint. Unwind. Okay, and then just stretch. Okay, and then we'll put the strap down. And this is a broomstick. So you have the right leg, the knee over the hip. So it's in the back of the right leg and the front of the left leg. And then press the legs into the bar. The purpose here is to align your pelvis. So we're evening out, your quads and your hamstrings, centering the sacrum. Reverse the leg position. The elbows should be straight, shoulders are down, and with a firm grip. Make sure you hold on around the stick and not thumbs over top. That thumb over top angle often leads to arthritic thumb pain. Okay, broomstick down. So next, back to the chest, we're going to open up the pecs and work on core stabilization. So the arms are like a Y, your palms face up. And just reaching across your chest. Some people will feel it in their biceps and the front of the shoulder. As we practice, it'll get better over time. Okay, and now we're going to do a cradle rock. So you imagine you have a big stability ball on your abdomen and wrap the arms and legs around that ball and really try to envision that. Now we're going to rock side to side, but as you do that, your spine, right, your lower back shouldn't arch. So you have your little bit of arch, that's your neutral spine angle all the time. And as you're shifting direction and rocking, that arch should not increase. Okay, so not a pelvic tilt. You're stabilizing your abs and protecting your spine. Okay, and then again, arms and legs down. And for activation of the core, I like to do this dead bug angle. Your arms are up over the shoulders and elbows are bent. The knees are over the hips. It's not better to just do a lot of dead bug variation here. Here we want to make sure we get the abs bracing. So the right leg, if you just push it forward a couple of inches and hold. Your lower back, again, neutral spine, a slight arch. When you bring the leg back to start, that arch shouldn't change. Left leg a little forward. It shouldn't be more arched as you're moving like that, and hold. So your core stabilization, leg back, right leg. Make sure you're not tightening up the neck and shoulders here. Right leg back and left leg. And rest. Okay, and now to even out the rotation of the spine, straighten the right leg and turn onto the right side. Bring the left knee around to the front. With the left hand, reach back toward the right foot and the right hand toward the left knee. So even out the left shoulder is back and the left knee is forward, and they should be the same height from the floor. It's important not to just roll the knee forward, then you'll over rotate your lower back and pelvis. Okay, now we're going to turn onto the left side. So start left leg is straight, turn onto the left, bring the right leg around. With the right hand, see if you can get the left foot. And if your hamstring cramps, just leave your leg back there. Left hand, hold on to the right knee. Okay, the right shoulder is back and the right knee is forward. Both the same heights from the floor. You don't need to get your knee to the floor, just even out the shoulder back, knee forward. Okay, now we're going to go through that a bit quickly again. First thing though, we're going to just work on the neck strengthening because all of us, the heads go forward too much. So your hands can be either on your abdomen or under the lower back. Right foot, right leg bent, left leg is straight. Think of the top of your head, somebody's pulling from the top of the head straight back, chin toward your throat, and let the head come up a little if you can do it, and elbows up. However, the chin should be toward the throat. Hold and down. It's not good to let your chin go up. That's what most people make that mistake. The chin, only do what you can with chin toward throat. Lengthen the spine first, elbows lift, chin down, head up. Keep lengthening the spine, keep the chin down. It's not easy to do. And down, right leg straight and left leg up. Okay. Lengthen the spine first, your head is on the floor, chin is toward the throat. Elbows lift, head up and hold. A deep breath here. And down. And lengthen, chin down, elbows, head up. And rest. Okay, and back to the hamstrings here. So the strap. Okay, right leg. So for our sessions, the knee is over the hip and then straighten the popliteal angle we're working on. So keep your knee over your hip joint. For our purposes, it's not better necessarily to pull your leg back. Just keep the knee over the hip and stretch so you set your hip. The femur sets in the socket of your hip joint. Switch to the left leg. Good, and pull. So where should you feel this? In the back of the leg, in the hamstrings, the calves, not the knee, the Achilles perhaps, and into the hip joint. If your symmetry is a bit off in your system, you might feel it down the outside of one leg or different angles, but ideally you should feel the same both sides. Okay, strap down and broomstick. Okay, right leg is knee over hip. So you're pressing away from you with the right leg and pulling toward you with the left leg. And again, if you get used to the system and you don't feel like you need to go through this, switch your leg position. The weightlifting component will start about halfway through. But this series that we're practicing will really help you over time in your basic foundation. Okay, and broomstick down. A Y position of the arms. And you'll notice your chest feels more open this time. You can reach more. Okay, and arms and legs are wrapping around the stability ball. This time we're going to rock to the left and hold. Just stay here, find your point of balance. And rock to the right and hold. And center. Okay, relax for a moment. Or dead bug position. So the elbows are bent for this version. Right leg slightly forward. You have your neutral spine, and we're just holding here, creating stability of the abs. And leg back, left leg. And right leg. And left. Rest. If you feel it in the quads, then just your quads are too dominant or hip flexors. Okay, right leg is straight, turn onto the right side. And left hand reach toward the right foot or just keep the leg back. Even out the left shoulder back, left knee forward. The head angle, I like to have chin toward right shoulder. Okay, then lie on the back again. Left leg is straight and right leg comes around. Okay, and right leg, take right hand, reach toward the left foot. Left hand toward the right knee and hold. Okay, and unwind. Okay, so next thing we're going to do is roll out the quads. So if you could get a foam roller if you have one, and if you can't, you don't like doing the foam rolling part, you can just sit up like this, and even like a rolling pin or a foam roller, you just roll out your quads. Sitting in a chair works really well. For people who are, can't get up and down very well, I let them sit in a chair and do that. But I do encourage everybody to get up and down off the floor, but that's another day, we'll cover that topic. Okay, now right leg, including like these amazing baseball players, right? We're going to roll out the right leg, starting at the knee. I would do one leg at a time, because when you do two, if you put both legs on the foam roller, your back is going to hyperextend. With one leg, you have more control of your abs here, so your back won't arch out. Like these amazing baseball players, how fast they get up, spin around, throw the ball. So we're going to work on moving in that direction, right? We want to be fast and quick and competent and up and down. That's our agility drill. But again, those are topics we'll cover over time. Okay, switch to your left leg if you haven't yet. Okay, so after rolling out our quads, we're going to work on a really important area here. So this is a foundational exercise for the multifidi. I'm just going to take a moment and explain. So if you're wherever you are, just get comfortable for a second, sit up. So in our spinal column, okay, we have the vertebrae, right? They're stacked like that on top of each other. And then there are small muscles called the multifidi that attach 1, 2, 3 vertebrae, 1, 2, 3. So it allows the vertebrae to have a small amount of rotation and bending in different angles. Because of sitting, the multifidi atrophy, that means they lose tone, those muscles become weak, and then our spinal column doesn't hold together properly. And it's like if you have a chair, right? You have a strong seat, you have strong legs. If those screws are loose and someone sits on the chair will fall apart. So we want strong legs, strong back, strong core, yeah. But if the multifidi are weak, your body will essentially fall apart. So that's why this is the most important. We're going to do a few different variations, but today it's called prone position with single leg lift. This is what it looks like. Here we're strengthening the multifidi, or multifidus is the whole big long muscle. So the elbows are under the shoulders, and the eyes, really critical, don't let your head tip up. Your eyes are looking through the elbows, okay, and the knees, the hips over knees. And you do one leg at a time, toes curled under. Right leg I'm going to start with, so you slide the leg, really important that you slide the toes along the floor, foot is flexed, straighten the leg totally, and then lift and hold 5 seconds. If you can't lift, you can just keep the leg on the floor. We're going to do one set together, so if you could get ready, we'll do a set of 5. So you're on the elbows, hips are over knees. Eyes are set, push into the floor, your shoulders will get tired. This is really good for strengthening your upper back as well. Right foot, slide the toes back along the floor, fully straighten the leg, then lift, hold. The hips shouldn't tip up on the right side, and you should not be shifting over to the left. Foot down and slide forward. Press, make sure you're pressing the elbows, right leg, slide, straight leg, lift, hold. Stay centered, that's your goal here. Try not to shift to the side. Foot down, slide the leg back. Leg straight, totally straight, then lift. Hold. Keep the leg straight and put the toes down. Slide the leg forward. We'll do one more. Right leg. Lift and hold. Foot down, slide forward. Now rest, so you might take some pressure off now because I know the shoulders get tired. Okay, and now we're doing the left leg. So the elbows are under shoulders, push into the floor, your eyes are looking in between the elbows. Okay, brace, left leg, slide the toes, straight leg. Make sure you don't out toe. That means don't angle your foot out. Your toes should be pointing straight down. Toes down, slide the leg forward. Left leg. if you out toe, it'll twist your femur and your hip joint. And that'll cause a rotation of the spine and shift your pelvis, like, well, not a good thing. Foot down. So we're working on our alignment and trying to straighten our bodies. Left leg. Keep pressing the elbows. I know it gets tiring. That's a part of the training here. And you know, it looks like you're not doing much, but when you start out, it'll be quite strenuous as you practice. And okay, the ideal left leg once more. So we're building up to 3 sets of 15 on each leg. It takes, 10 minutes. It is very challenging, I would say, for everybody. But the implications are that your body will not fall apart. Like that wobbly chair, tighten up those screws, then you can load it and you'll be really good for a long, long time. So thank you for coming. We'll be doing many more recordings like this. Those of you who are continuing, we're going on with the class. I'll make a short segment each time on one particular exercise. So that's your multi-foot strengthening for the week. Okay, so now we'll continue. We're doing a second set of 5. Okay, so press the elbows, your eyes are set, right leg goes back, straighten totally, lift the leg and hold. Foot down, slide forward. So you see, it's not just your multifidi, right? It's right leg back, like your hips, you're strengthening your hip joint, you're strengthening your shoulder joint. Foot down. And a better spine angle means better nerves, right leg. So we'll have better balance and be smarter people. Like, as well as the strengthening bone density. I mean, there are other, of course, well-documented benefits of particularly the training they were doing the specific exercises even. Okay, rest. And that is improved cognition, incontinence. Next week, I think we'll do another one that's specifically to help with incontinence. Okay, switch left leg now. Left leg slide back, straighten and lift and hold. Always for me, the exciting thing is to put down, slide forward. It's finding these strategies to get better. Left leg lift. This week I started skipping, like with a skipping rope. Not very much, just a few minutes a day, put down. But I haven't done that for a long time, like years, God knows how long. Left leg. To help, with agility and quickness, because that's another thing when we get older, we lose, or not even get older, foot down, like young people, right? If you don't do things to practice quickness, you're going to lose it. Left leg lift. When we're young, we have some of that resilience, and it goes quickly if you don't practice it. Foot down, and left leg. And foot down. Okay, that's great. So now we're going to stand up. Great, so perfect. Now we're in time for doing our weightlifting. And as we always do deadlifts, because when people do squats, they usually hurt themselves, so with their knees and backs. So we're going to always do a deadlift version. And if you have particular discomforts, your back sore or your shoulder sore, just use a lighter weight and do it with less repetitions and more control. So I think let's practice that for today. So we're going to do deadlifts, but we're going to do less repetitions, but with a hold, and make sure that we hold the proper angles. So this is one I personally like to use, a heavier weight. And because you're at home, you don't need 100 pounds, but if you have even 5 or 20, whatever works for you. Okay, so we're going to do just the center position. Feet are like this, just a little wider than hips. Okay, like that. The important thing is don't lean forward like that. That will strain your back. So you must always keep the weight like this between the feet. And you don't have to go all the way to the floor. You should not. Actually, the hands maybe just below knee level. Okay, so we're going to do 5-second holds at the bottom and the top. So a little different variation than what we've been doing. Both hands are holding on. The longer you hold on to the weight, the better your bone density will be. Okay, tuck the chin, brace your abs, hip hinge, set your position, now hold. Engage your glutes and stand. And stand all the way up. Hip hinge and hold. So we're going to be very controlled. Make sure you're using the glutes and stand. And hold. Keep the chin tucked, hip hinge. We're going to use different, at different times, we'll use stand and hold. Isometrics, this is isometric hold 5 seconds. Hip hinge, hold. Glutes and hold. Okay, hip hinge. And glutes. Shouldn't feel this in the back. Like your back is stable, you just strengthened your multifidi, hip hinge. You should feel it in your buttocks or your legs, it absolutely will, and then across the upper back. Glutes and stand. Hip hinge. You might be sore, because what happens when you do isometrics like this? Glutes and stand. And hip hinge. Glutes and stand. Hip hinge. Glutes and stand. Okay, weight down. That when you hold, that in our body we have a lot of tissues, even muscle fibers that we don't use, okay? And we want to recruit them. The ones that are not doing much, we want to recruit them. So one way is lifting really heavy weights and you strain really hard, right? Another way is you hold and then you get tired, and so more of those dormant tissues start being recruited, so you build up more strength. Okay, set 2, same thing. Okay, so chin is tucked, stand really tall. Brace your abs, hip hinge back, so the weight is vertically between your feet, hip hinge, hold. Squeeze your glutes and stand. Okay, hip hinge and hold. Glutes and stand. Now think of the lower back, right? Your lower back should be neutral, hip hinge, so you always have that slight arch in your lower back. Glutes and stand. So make sure you don't like round your lower back when you're going up and down. Hip hinge and hold. And stand and hold. Hip hinge. And when you're at the bottom, make sure you're using the glutes. Glutes and stand. Hip hinge. Make sure the chin is still tucked in. Glutes and stand. Hip hinge. And glutes. So that during this entire set, your spine shouldn't be fluctuating. Hip hinge. If you twist a little to the side, or if you arch your back or round your back, then it weakens the spinal column. Hip hinge and tall. One more. Okay, and rest. And weight down. Okay, that was really good. So we're going to do one more set, same thing for today. And when you do the hinging, when you come to the top here, this is called lockout, you really should feel like your buttock muscles are squeezing from the sides like that, like big pliers are squeezing your glutes together. So every time we'll go hip hinge, hold, then we'll stand up and squeeze the glutes from the sides. Make sure you don't lock the knees, and make sure you don't push the hips forward, that will pinch the lower back, okay? So here we go. Last set. We're protecting our spine. Chin position, brace your abs, brace the lower back. Shoulders are open, hip hinge back. Glutes and stand. Stand all the way up, that's better. Hip hinge, hips back. Squeeze the glutes, stand up straight all the way. Squeeze the glutes, not locking the knees. Excellent. Hip hinge. And glutes and stand. And hip hinge. Glutes and stand. And hip hinge. Glutes, stand all the way up. Keep the chin back. 2 more. Stand all the way up. You might be a bit sore, right? Because these holds, like I said, you're recruiting more muscle fibers. The muscle fibers that haven't been doing much. And they'll get stronger, so you may feel them. All right, that was great. Now we'll put the weight down. So in terms of bone density, there's a really, really simple way to do that for your upper body strengthening. We're going to try that today, and that's just carrying something. But we want to do it in a way that we're going to make sure our shoulders and body and back and feet are angled correctly and even out our imbalances. So what we're going to do is carry the weight on the floor. But first, this is something we'll do regularly as well. This is to help your upper back and to prevent your shoulder injuries. This is a rolled up bath towel. And you might need a little pillow for your head. We're getting the shoulders ready, like I said, for your upper body lifting. This is a medicine ball. You don't need to use that. A beach ball would be great, or a basketball even. If you have a smaller medicine ball, that also will be okay. Yeah, we're going to do 3 different exercises. I think I'll just demonstrate this first because it's harder to see when we're on the floor. So the first one is like this. You go W to Y, like this. The second one is the palm of the hand is facing the shoulder, and you just reach back like that. And the third one, you have the arms in front and you reach, like spread the shoulder blades like that and reach up, okay? So if you can do it, you don't have to have the towel if it's uncomfortable. It's good to do it. And again, you might want something for your head if your neck is a bit stiff. Okay, so that's my towel. Now the arms are this W angle. Your arms don't have to be on the floor. Some people can't even get close to that. So not to worry, your palms though are facing up, okay? You just do what you can and then you reach back. Some people get a lot of crunches and crackles. Others are just very, very restricted, like can't move. Some people get really severe nerve pain. You know, just make it simple, make it easy, comfortable for yourself. And with regular practice, it'll get better. Now, you know, of course, if we were all in perfect condition, it would be really easy and smooth, no crunching. But we're going in that direction. Okay, now second one, right hand, put your hand on your stomach. Left hand, your palm of your hand is facing the shoulder. And then you slide your left arm, like the fingertips toward the floor. Not that they have to be on the floor, but in that direction. And you're just sliding back and forth. This action, if you can notice your upper trapezius, you know what we massaged out at the beginning, that it's toned down, like it's not grabbing on. That's why we're doing these exercises currently, because most of us overuse the upper traps, so we want to use a muscle called the serratus more. The right hand now, palm facing the shoulder, the left hand on your abdomen, and you just reach back and forth. Make sure if your head is on the floor, that, or everybody actually, the chin is down. Your chin be going up to the sky. So always we want to lengthen the back of the neck. Okay, so next, so you don't need a ball. You can just reach up with the arms and reach with your fingertips like that. Keep reaching away from you as you bring the arms back. Or if you want to, you can do like that, have the legs up. I like this dead bug position. So if you have a ball, you can use the ball. And we're just reaching and reaching back. So this will help facilitate the, as I said, the serratus anterior muscle to work more, become stronger. That muscle, we often don't use that muscle enough. And instead, the upper trapezius is a compensation pattern. So we're teaching ourselves how to move better. And yes, you should feel your abs. Okay, and fall down. Okay, now we're going to stand up. We'll roll to the side though. If you sit up, you'll strain your neck, right? We don't want to do that. All right, so now for the upper body strengthening today, we're going to do carries. And ideally you have different weights. So we're doing overhead if you can, shoulder level, and then weight down by the side. Dumbbells or kettlebells, cans of soup, so whatever you have. Okay. All right, so yeah, so we're going overhead, shoulder level. That's why we prepared our arms. So you can do this for longer. I'll just count some steps for us to make it consistent. But the first angle, if you can do it, the arm is like this, just straight up over the shoulder, okay? And you're holding onto a weight. Well, one thing to be careful of is this: you don't want to let the wrist go like that, bend backwards. So the wrist should always be up like this. So it's a strong, straight wrist. All right, so that's good. So we're going to start with right arm overhead and reach. And we're just walking forward and backwards. Okay, so you see, because the weight's on one side, that you're strengthening your stabilizers, your core stabilizers, and the stress across your spine. Actually, that's today we're really doing a lot of work for the back. Okay, weight down. So you can do that longer, just because we don't have much time. I'm going to continue left hand and reach. And if you've had a severe shoulder injury, or your shoulder's just sore, your rotator cuff's a bit sticky, then you won't be able to get the arm up fully. So okay, the important thing is upper trapezius. So you should only lift as high as you can using the muscle that's called the serratus. We'll talk about that next. We'll put this weight down. Okay, so if you bring this arm up like this, okay, and then squeeze, you want to feel this muscle right here. It's on the shoulder blade and the side ribs, like that. You should feel a contraction there. A lot of people, they can't get that to fire. So what happens instead is you use this one up here, and that restricts your shoulder joint, pushes your head forward, all kinds of stuff. So whenever we're doing anything, think this is down, but try to engage here. So now we're going like this. The weight is at the shoulder level. That weight is in front of the shoulder, and the elbow like this by the side. And really focus on the serratus. Right hand. That will really clear up a lot of your shoulder problems. Okay, elbows touching you. It's going to be by your side, the hand in front of shoulder. And now think of the serratus, okay? Try to actively engage that muscle. A simple way I find to do that is if you just keep the shoulder down from the ear and you don't allow yourself to use your upper trapezius, then you end up using what you should be using, that serratus muscle. I mean, there are a lot of muscles working, right? Your rotator cuff, your wrist is getting stronger. Weight down. Left hand. I also like this for the feet. Okay, left hand, just make sure shoulder is down. Don't lift up from that shoulder joint. That's better. And then squeeze from under your armpit. Try to get more control from there. That's better. So when you're walking, there are different loads and angles, right? Now the weight's over to the left. So that's loading your feet and knees and hips, your body in different positions. And so your body becomes stronger and more competent at different angles. Okay, that weight down. And next. Okay. Now we go to a heavier weight. So I generally go 10, 15, 25. Or you go 5, 10, 15, whatever you have. So this is 25. Okay, so now here, you need to, don't drop the shoulder. The shoulder should be level. So you have to kind of lift here. But again, brace your serratus. The arm is down by the side. Do not allow the arm to swing. If you swing your arm, then you'll twist your back and your knees. So the arm is stiff and straight. Okay, and left hand. Also for your grip strength, left hand. So grip strength is a predictor of mortality. So if your grip is stronger for you, right, according to your size and weight, then you'll live longer, or that you're expected to live longer. And so when you're carrying these weights, they will make your grip stronger. And here we're doing this in a controlled place, right? So we're evening out the carry. Weight down. Okay. Great. Okay, so we're going to continue with that. So back to the right hand with the heavy weight. We're going back up the chain. And so I use this opportunity, right? Because when you're, like I said, you're holding on to this heavy weight, you've been carrying these weights for 10 minutes. And during that 10 minutes, your bones will adapt. Like they feel like you're heavier. So the bones want to adapt to become stronger to tolerate your heaviness. Weight down, left hand. That's why weightlifting is great. Go up forward. Similarly with the band pulling exercises, right? When you pull on a stretchy band and there's resistance, your muscles contract, and that contraction of the muscles pulls on your bones. And that action of pulling on the bones helps them to become stronger. The difficulty becomes if your tissues are weak, right, and they're very fragile. Okay, down. Okay, now shoulder level. Right hand shoulder level. Just make sure don't lift with your upper traps, right? You want to make sure shoulder is level. Shoulders are level, but not tight at the base of your neck. Okay, that's perfect. That's exactly the idea. The base of the neck shouldn't be tight. And you're squeezing under the armpit, stabilizing your shoulder blade on the rib cage. So there are people often who they don't do anything and they just go for a walk and a bone in their foot breaks. Like they didn't do anything, it just broke. And weight down. That's when the bones are weak and probably the alignment is off. The bones are fragile, so you pull on the bone too much and it breaks. Same thing with the spine. Left hand, people often get fractures in their spine. They're not doing anything, just sitting. That's usually the problem. And so those bones are fragile and weak and they just fracture for no reason, really. But how to strengthen it is what we're doing. You need to move. You need to load it in different ways to stimulate that growth and repair process. Okay, weight down. Okay, now we're doing overhead. Now this is when people run into trouble. You need to reach up, get your coat on, whatever. So when you're lifting the arm up, is that shoulder stays down. This part doesn't lift. You reach like this from the shoulder blade. The shoulder blade comes under the armpit like that. And then from here, you can reach up like that from the shoulder blade. But if you go like that, then besides your neck gets all jammed up and the rotator cuff gets jammed up. And if you force it, I have to reach the muscles, the connective tissue gets torn apart, right? So you need to keep this upper chest quiet as you reach up overhead, clear. Okay, right hand. And again, if you can't do that, how do you determine how high? You lift as high as you can by feeling your serratus muscle. Okay, so we're here, you feel the serratus, you feel that, then as you push up, feel that muscle, feel the serratus, feel it engaged. And if you can get all the way up and you still can feel that muscle's engaged, then that's perfect. And if you lose it partway through, then don't go any higher. Try not to compensate using your upper trapezius. Okay, now I always mention this too. When we walk backwards, studies have shown always consistently 100% if you do exercises going backwards, like walking backwards, you have better cognition and improve your brain function. Down, left arm. Okay, remember straight, try to do that one. So elbow, yeah, ideally just straight. Might not be totally. I'm still working on a dislocated fractured shoulder, but it's pretty good, I must say. Quite amazing. Okay, right down. Great. Now we'll just do one more thing that we really should take care of all the time. The hip external rotators, or muscles here on the outside of the hips. That's why you know this, like lifting the legs sideways is a really popular kind of exercise, but there are better ways, and ways that are better and ways that are not as good for doing that. We're going to do what's called a band walk, lateral band walk. I do this every day. So if you have a stretchy band that's about a foot in diameter, that goes around the legs. It's commonly known monster walk, but some people don't like that term, so I call this a band walk. So we're going to walk sideways with a band around the legs, just above the knees. Okay, so like this. Now, importantly, not like that. If you do that, then that's going to hurt your knee joints. So when you set up, you need to make sure you do a hip hinge like we practiced earlier, okay? And the knees, well, it depends how tight your band is. Your feet may be closer or wider. But the feet always are forward. Don't go like that out toe. That'll twist your knees, okay? So toes are forward. I bring the arms like this because it helps to serratus, right? You should feel it here under your armpits. So you're engaging your serratus. Then you hip hinge. Now, the steps are small, really small, like 1 inch to the right. Really, really small steps. Bigger steps are not better. Smaller steps are better. Now go to the left. And rest. Okay, also the hips shouldn't go like up and down like this. The hips should be totally level the entire time. Set the arms, engage the serratus, hip hinge, step to the left. Really small steps. Really small steps. Step to the right. Okay, stand. It's important to stand and recover a little. Sorry, going this way. Okay, so now hip hinge, step to the right. Keep the chin down. Don't let your head go forward. That's better. Okay, step left. So where do you feel this? You should feel it in your glutes, your buttock muscles, right? Okay, stand up. Okay, step left, hip hinge, step left. Step right. So you see, when you're doing this and you're using the muscles in your hip joints, you're strengthening your femoral neck. You're building your bone density in your hip joints. Okay, band off. So hopefully you don't fall down, but if something happens, and that does happen, then your bones will be strong, right? Okay, thanks a lot. That was really fun. And I hope to see you next week. And enjoy the videos. I hope everybody finds benefit from it.